The world of infectious diseases is constantly evolving. New threats emerge, challenging our understanding and our ability to respond. One such threat, Candida auris, has quietly entered the stage, and its presence is a cause for serious concern. This fungus, first identified in Japan in 2009, has rapidly spread across the globe, leaving a trail of difficult-to-treat infections in its wake. It is a stark reminder of the ever-present threat of infectious diseases, particularly within healthcare settings. Candida auris is a type of yeast, a single-celled fungus that thrives in warm, moist environments. While many species of Candida are harmless, some, like Candida auris, can cause serious infections. What sets Candida auris apart is its remarkable ability to resist the very drugs designed to defeat it. This resistance makes it a formidable opponent in the fight against infectious diseases. The emergence of Candida auris has sounded alarm bells in the medical community. Its ability to spread rapidly, its resistance to multiple drugs, and its predilection for the most vulnerable among us make it a significant public health threat. Understanding this emerging pathogen is crucial in our efforts to contain its spread and protect those most at risk. The rise of Candida auris has been swift and alarming. Once confined to a single continent, it has now spread to all corners of the globe, gaining a foothold in healthcare systems worldwide. The number of cases has steadily increased over the past decade, highlighting the challenges in controlling its spread. In the United States, Candida auris was first identified less than a decade ago. Since then, it has spread to nearly half of the states, with cases reported in various healthcare settings. The Centers for Disease Control and Prevention, or CDC, has classified Candida auris as an urgent threat, underscoring the need for immediate action. The increasing number of Candida auris cases is a cause for concern, but it is the fungus's characteristics that make it particularly worrisome. Its ability to survive for extended periods in the environment, coupled with its resistance to multiple antifungal drugs, makes it a formidable opponent in the fight against infectious diseases. Candida auris has shown a remarkable ability to spread across geographical boundaries. Initially identified in Asia, it has now been reported on every continent except Antarctica, highlighting the ease with which infectious diseases can traverse the globe. This rapid spread is likely due to a combination of factors, including international travel, trade, and the fungus's ability to persist in the environment. The global distribution of Candida auris cases is not uniform. Some regions, particularly those with less robust healthcare infrastructure, have reported higher numbers of infections. This disparity underscores the importance of strengthening infection control measures globally, particularly in resource-limited settings. The interconnected nature of our world means that infectious diseases are no longer confined by geographical borders. The spread of Candida auris serves as a stark reminder of the need for international collaboration and cooperation in the face of emerging health threats. Candida auris possesses a unique combination of characteristics that make it a particularly challenging adversary in the fight against infectious diseases. Its ability to resist multiple antifungal drugs, its persistence in the environment, and its predilection for healthcare settings make it a formidable opponent. The fungus's drug resistance is perhaps its most concerning characteristic. Candida auris has shown resistance to multiple classes of antifungal medications, making treatment difficult and, in some cases, impossible. This resistance is thought to be due in part to the overuse and misuse of antifungal drugs in both human and animal health. Candida auris's ability to survive for extended periods on surfaces further complicates efforts to control its spread. The fungus can persist on medical equipment, furniture, and even personal items, making decontamination efforts challenging. This persistence highlights the importance of rigorous cleaning and disinfection protocols in healthcare settings. Section 5. The vulnerable at greatest risk. While anyone can contract a Candida auris infection, certain individuals are at a higher risk of developing serious complications. Those with weakened immune systems, underlying health conditions, or who have undergone recent surgery or prolonged hospital stays are particularly vulnerable. Patients in intensive care units, those with central lines or other invasive devices, and individuals with compromised immune systems are at increased risk of Candida auris infection. These patients often have multiple risk factors, making them particularly susceptible to this opportunistic pathogen. The elderly are also at increased risk of Candida auris infection. As we age, our immune systems naturally weaken, making us more susceptible to infections of all kinds. This vulnerability, coupled with the fact that many elderly individuals reside in long-term care facilities where Candida auris can spread easily, makes this population particularly vulnerable. Section 6. A healthcare system under siege. Candida auris poses a significant threat to healthcare systems worldwide. Its ability to spread rapidly within healthcare facilities, coupled with its resistance to multiple antifungal drugs, makes it a nightmare for infection control practitioners. The fungus can spread through person-to-person contact, contaminated surfaces, and even the air, making containment difficult. Hospitals and other healthcare facilities are particularly vulnerable to Candida auris outbreaks. The high concentration of patients with weakened immune systems, the frequent use of invasive devices, and the constant movement of staff and visitors create an ideal environment for the fungus to thrive. The emergence of Candida auris has highlighted the importance of robust infection control measures in healthcare settings. Hospitals have been forced to re-evaluate their cleaning and disinfection protocols, implement stricter screening measures, and increase staff training on infection control practices. Section 7. A race against resistance. The rise of drug-resistant organisms like Candida auris is a stark reminder of the importance of antibiotic stewardship. The overuse and misuse of antibiotics and antifungal drugs have fueled the development of resistance, making it more difficult to treat infections and raising the specter of untreatable diseases. The development of new antifungal drugs has been slow, and existing medications are not always effective against Candida auris. This situation underscores the urgent need for new treatment options as well as innovative approaches to infection control. Combating drug resistance requires a multifaceted approach. This includes promoting appropriate antibiotic use, investing in the development of new drugs, and exploring alternative treatment strategies such as phage therapy and immunotherapy. Section 8. Combating the silent invader. Containing the spread of Candida auris requires a coordinated effort involving healthcare workers, public health officials, and the general public. Early detection and isolation of infected individuals are crucial in preventing outbreaks. This involves screening high-risk patients, implementing contact precautions for those infected, and promptly isolating suspected cases. Environmental disinfection is also critical in controlling the spread of Candida auris. The fungus can persist on surfaces for extended periods, making thorough cleaning and disinfection of healthcare settings essential. This includes using specialized disinfectants that are effective against Candida auris and ensuring that all surfaces, including medical equipment and furniture, are properly cleaned. Public awareness is also crucial in the fight against Candida auris. Educating the public about the fungus, its modes of transmission, and ways to reduce the risk of infection can help prevent its spread. This includes promoting good hand hygiene practices, encouraging people to stay home when sick, and raising awareness about the importance of infection control measures in healthcare settings. Section 9. The future of infection control. The emergence of Candida auris serves as a stark reminder of the constant threat posed by infectious diseases. As we continue to battle known pathogens, new threats will inevitably emerge, challenging our understanding and our ability to respond. The future of infection control will require a proactive and adaptable approach, constantly evolving to meet new challenges. Investing in research and development is crucial in staying ahead of emerging infectious diseases. This includes developing new diagnostic tools, novel treatment options, and innovative infection control strategies. The fight against infectious diseases is a collective effort. International collaboration, data sharing, and coordinated responses are essential in combating global health threats. By working together, we can strengthen our defenses and protect ourselves from the silent invaders that lurk in our midst.